Hi, I'm Sheena Larson, and this is my wonderful volunteer here, Morty. And this is Jessica. I'm going to be going over some directional terms with you, some different directional planes, joint movements, and recumbency positions. To start off with, I'm going to explain that whenever I use the term left or right, I always refer to the animal's left and right. For example, this is his left paw, and this is his right paw. It doesn't matter where I'm standing in relation to him. This will always be his left paw, and this will always be his right paw, even if I'm standing in front of him looking at him. The first plane that I'm going to be going over is the sagittal plane, which divides him into left and right parts. So it cuts him down along here, and it can be anywhere. It can be here, or here, or here, splitting him into left and right. If it is directly down the center, then it is referred to as the median plane or mid-sagittal plane. The terms are interchangeable. If I want to divide him into front cranial parts or back caudal parts, then it's the transverse plane, which can again go anywhere along the body, here, 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 or here. Those are all transverse planes. If I want to divide him into top dorsal or bottom ventral parts, then we use a dorsal plane, which is kind of similar as if he was standing in water. It divides him along here, and again, it can go anywhere. It can go here, or here, or here, or here. And then to go over the different terms that I was talking about, cranial refers to a directional towards the head. Caudal is towards the tail. Since cranial refers to the skull, if I want to describe anything on the skull, we use different terms. We use the term rostral, which means towards the nose, or caudal, which is again towards the tail. If I want to describe something that is inside of him, towards the center of his body, like if he's stabbed, it is deep. If it is just along the surface of his body, then it's superficial. If something is along the center of his body here, it is medial, and if it is away from the center of his body, then it's lateral. Along his limbs, the front of the leg here, from here down to his carpus, is the cranial surface. The back of his leg, from here down to his carpus, is the caudal surface. From his carpus down is the dorsal surface, and then along the bottom of his foot, from the carpus down, is the palmar surface. If I want to refer to something as being closer to his body, then it's proximal, and if it's away from his body, then it's distal. On his back legs, the terms are similar. This is the cranial surface from here to here. The tarsus is the cranial surface. From the back of his leg, from here down to the back of his tarsus here, is the caudal surface. From his tarsus down along the top is the dorsal surface. From his tarsus along the bottom of his foot is the plantar surface. If I want to refer to something as being inside, like which direction on his paw, the outside surface is lateral because it's away from the center of his body, and the inside surface is medial. And if I get Morty to sit, because he only has 3 legs, I'm going to demonstrate some joint movements with you. First, I'm going to get him to flex. Flexion is the reduction of the angle between the 2 surfaces. So it's a bending movement, so when I go like that, and I'm reducing the angle, that's flexion. The opposite is the extension, the straightening movement, which increases the angle between the 2 surfaces. Come on, bud, just go up a little. If he's moving away from his body, like this is abduction. away from his body. Towards his body is adduction. In. And then Morty's going to volunteer some recumbency positions for us, so we can get him to lie down. And right now he's demonstrating sternal recumbency because he's on his sternum. If we shift and move him onto his side, he is demonstrating a right lateral recumbency position. We refer to it as right lateral because he's laying on his right side. And if we keep shifting him onto his back, he's in dorsal recumbency because he's laying along his spine. If he's somewhere in between lateral and dorsal, somewhere like this, where he's not directly flat and not directly up, he is in an oblique recumbency position. And finally, I'm going to go over some different regional terms on him. For example, the area of his head in between the base of his ears here is referred to as the poll. And on his lower chest, if you put your head up, bud, this is his brisket. The protruding part of his face, including his nose and mouth, is the muzzle. His knee here is referred to as the stifle. And the base of his tail, right here, is the tail head. That should be everything that I had to go over.